Hello everyone, my name is John. I'm a pharmacist. I went to school for this and I'm going to try to answer your drug questions. Please submit them at the bottom. My friend Taylor asked me, can I take NyQuil Tylenol? I've got a raging cold. And the short answer is no, because NyQuil already has Tylenol. So what you're doing is you're doubling up. And this is a key point to remember. When you go to the drugstore and you feel like you have a cold or something you're trying to treat, there's a lot of combination products, but all of them, many of them, not all of them, have some Tylenol in it. So you want to make sure you don't double up on the dose. The other day, my friend Hazel fell down and hurt her back, and then she was asking what can she take over the counter. And the short answer is there's a drug called Ibuprofen, also known as Motrin, also known as Advil. So essentially, they're all ibuprofen, 200 milligrams, and you can take 1 to 2 tablets every 4 to 6 hours with food. Make sure you take it with food. Now, the reason I'm talking about this is because when you see the doctor, they can prescribe you higher doses, right? If the pain is really bad, you really should see the doctor. Okay, now when you go to the store, as always, when you're trying to treat pain, you're going to see a lot of different options over the counter. And essentially, there's really 2 types of painkillers that you can buy. One is Tylenol or acetaminophen, and the other is a class called NSAIDs. Most commonly would be something like Ibuprofen, also known as Motrin or Advil. And there's other drugs in this class that I can describe later. But essentially, you can take both of these for headache or pain, but the difference is that Tylenol you can take with or without food, but this class of drugs, Ibuprofen, you have to have something in your stomach. So even if you're not hungry, just make sure you eat something. The other key difference is that these class of drugs, Ibuprofen, can thin the blood. And so if you're somebody who might be on a blood thinner at home for maybe to prevent a blood clot or some other reason, you want to avoid this class of drugs. Now the other last thing to remember is that Ibuprofen and NSAIDs or aspirin, they can treat inflammation, right? They're anti-inflammatory drugs. And so if you have an injury where there's a lot of inflammation, this might be a better choice to start with than Tylenol. And I'm just going to make 2 final points. The reason why we tell people to take Ibuprofen and the other drugs with food in your stomach is because those drugs will erode the lining in your stomach and increase risk of stomach ulcers. The other thing I want to add is that if you're 13 or younger, don't take aspirin. It's been associated with a severe side effect called Rye syndrome. Thank you for sitting through and watching my entire video. I really appreciate it. If you have any more drug questions you want me to try to answer, please leave them in the comment section below. And if you think this kind of information is helpful, please hit the subscribe button down below.